So our last lecture for muscular system will be muscular anatomy. So muscle attachment. All muscles are attached at least 2 points. The origin is an attachment to an immovable bone, and the insertion is an attachment to a movable bone. Types of muscle movement. Flexion, often found in hinge joints, bring two bones closer together. Extension is the opposite movement of flexion. All right, pulls two bones further apart. Hyperflexion or hypertension is flexion beyond the normal position. Types of muscle movement. Abduction pulls limbs away from the midline. Adduction pulls limbs towards. So you have the adductor and abductor machines at the gym you sit in them and you pull. Abduction pulls limbs away, the opening, pull the legs open, and the adduction pulls them closer together. Circumduction is the rotation of the limb, so it rotates. Rotation is the movement of a bone in a circular direction around a central axis. Medial rotation is toward the midline. Lateral rotation is away from the midline. So if you were to take your hand and put it straight out in front of you up against a wall, and you were to rotate it out to the outside, it's lateral. Medial is toward the midline. Okay. How are muscles named? Some muscles are named based on the direction of their fibers. Rectus means straight. Rectus abdominis. Oblique means diagonally. So the external abdominal obliques. All right, so they're diagonally arranged. Muscles within a group may have many different names based on their size. Maximus and longus indicate larger muscles. Minimus and brevis indicate a smaller muscle. Prefixes like bi and tri are used to indicate multiple heads or attachment sites. So triceps brachii would have 3, biceps would have 2. Muscles can also be named based on their origin or insertion bones. So we see this right here based on its attachment to the clavicle, mastoid, and processes and temporal bone. All right, it has a lot of different names there. If a muscle resembles the shape, it can be named after that shape. The deltoid, the delt muscles, the shoulders, look like the Greek letter delta, which is a triangle. Finally, muscle names can indicate a specific action. Flexor, carpi, ulnaris. So we see right here, went back too many. Flexor means flex. Carpi, talking to the carpos, and ulnaris, the ulna. So we see right here, we see the muscles of the skull, trap muscles in the neck, so the oculi, the eye muscles. Look at the frontalis, zygomatic bones, temporalis. Notice they're named a lot about where they are. Okay, a lot of these, so based on their location. All right. Head and neck muscles. Frontalis raises the eyebrow. All right. Masseter and the temporalis elevate the mandible. All right. Flatten the cheeks. Move the eye for blinking. Closes the mouth with the lips. Raises the corner of the mouth when smiling. Rotates the head and flexes the neck. So we see these right here. Here's the chest muscles. All right, we can see, or the upper body. Clavicle, we see the trap muscles again. Pectoralis major, latimus dorsi, external obliques, rectus abdominis. All right, so we see all these different muscles that come in, the muscles of the trunk. All right, pectoralis major adducts the humerus. Rectus abdominis flexes the vertebral column and protects and compresses the contents of the abdomen. All right, and we see the external obliques, external, internal, rotate the trunk. Here's the muscles of the back. All right, we see a lot of these the same. We see the lat muscles, obliques, deltoids, trap muscles, all these things that you've heard before. Will you be tested on the muscles No, you won't have a specific diagram on muscles to memorize. You might have a question too on this play posit, but you won't have on the test itself. Okay, so you see these different things that they do there. Here's the deltoid muscles, bicep muscles, triceps, brachialis. There we see these right here, bunch more. Right? Again, not going to be on the test, but it's important to see them so that you kind of get an idea of muscles you've heard before: biceps, triceps, deltoids, traps, things like that. All right, biceps brachii, flex the arm; triceps extends the arm; extensor carpal radius and ulnaris extend the wrist, and the extensor extends the 4 non-thumb digits. All right, here's the posterior, so the back leg muscles, the glutes, all right, the medius and maximus. And then we see biceps femoris, all right. We see the muscles of the calf, all right, biceps femoris. Think about the hamstring. It's like the bicep muscle for your lower leg. And then here's the anterior. There's the glute again. And we start seeing the quadriceps muscles, fibularis, tibialis, all right? And then here's the hip, the glutes, what they do. Gluteus maximus adducts and extends the legs. Gluteus medius abducts the leg. The hamstring group flexes the knee. So here's the hamstring group. And then the last two extend the foot. Sartorius flexes, abducts, and lateral rotates the thigh. Quadricep groups extend the knee. So here are the quads, 4 of them. And then continuing, tibialis anterior and fibularis flex the foot. And then we see right here, here's a kind of front side of the body with everything at once. All right, so there's all the bones in one, all the muscles in one spot. And here is the posterior view with all of those muscles again. So again, not going to have to memorize, but you will have to know other facts from the muscular lectures.